What is back pain? Back pain is a common reason for absence from work and for seeking medical treatment. It can be uncomfortable and debilitating. Back pain can have causes that aren't due to underlying disease. Examples include overuse such as working out or lifting too much, prolonged sitting and lying down, sleeping in an uncomfortable position or wearing a poorly fitting backpack. 1. Understanding your back. Your spine is made up 24 separate bones called vertebrae which are connected together by a series of ligaments and soft tissue. The lower part of your spine is joined to the sacrum which is part of your pelvis. The curves, shapes and various sizes of the vertebrae, along with the discs found in between them, help to evenly distribute the weight of your body on the spine and creating the flexibility necessary to bend or rotate your back. A complex group of muscles are attached to the spine which allows you to move your back. There are also postural muscles which help to maintain the shape and curves of your spine, keeping them in the correct position, as well as help to keep you upright. The spinal cord passes through the center of each vertebra. The cord ends in your lower back where it becomes a series of strands called the cauda equina, horse's tail. Either side of each vertebra are spinal nerve exits from the spinal cord which pass sensory and motor signals between your brain and a certain part of your body which the nerve innervates. What causes back pain? The most common cause of back pain, especially lower back pain, is a combination of poor posture and lack of movement, typically seen with people who sit for long periods. This is known as mechanical back pain and is not a serious condition. However, it can be uncomfortable and frustrating to experience a constant ache or pain in your back. Physiotherapy is ideal for treating mechanical back pain. Along with advice on correcting your posture, appropriate exercises and self-treatment techniques, your back pain should resolve in a few days or weeks. However, there are more complex causes of back pain, for example, disc prolapse, joint impingement, ankylosing spondylitis, osteoporosis, arthritis or fracture which require a more detailed assessment. 3. Symptoms of lower back pain. When you first start to develop postural back pain, it manifests itself as a low-grade ache normally combined with stiffness in your lower back. Symptoms tend to be relieved with light exercise or by avoiding long periods of sitting, for example at weekends. But if symptoms are ignored, the pain will become constant, just to varying degrees. The level of stiffness may also increase. You may experience any of the following symptoms: pins and needles or numbness in the buttocks, lower limbs or feet, pain going down the back or front of your leg, more severe back pain, especially when bending forward, excessive levels of stiffness in your lower back. These symptoms need to be properly assessed by an experienced physiotherapist. They will diagnose the cause of your back pain and provide appropriate treatment, management and advice. 4. Running and back pain. Lower back pain which develops from running is normally due to poor running technique. The most common running technique fault we see at our sports injury clinics is poor glute medius activation. This is one of the most important muscles for running as it helps to stabilize the pelvis, which in turn helps to maintain the alignment of the spine. They also are important for maintaining healthy hips and knees. Runners with poor glute medius activation tend to have a crouched style of running, making it difficult to adopt a normal upright running technique. As a result, the lower back gets overworked, which usually leads to pain. This common running fault is easy to fix using one exercise, the lunge. When performed correctly, it will help you to engage your glute medius muscles at the right time. However, the exercise needs to be performed correctly and it may take a few weeks to feel and see the difference. Your back pain when running may also be caused by poor posture due to weak core muscles. If you sit all day at work, you may also develop stiffness in your lower back and leg muscles. This is where carrying out a proper warm-up prior to running is essential. If you are not sure what is causing back pain when you run, an experienced sports physiotherapist will be able to help you work this out for you. 5. Does stretching help reduce back pain? It is almost a daily occurrence to have a patient attend one of our clinics suffering from lower back pain, to explain they have, for example, been stretching their back every day for a month and it has made no difference to their back pain. With typical posture-related back pain, the soft tissue structures in the lower back are overloaded. They have been at full stretch for hours on end until pain starts to develop. Therefore, it won't be a surprise to know that further stretching is unlikely to help. What is required is gentle movement, not stretching. However, stretching of other muscle groups like hamstrings, quadriceps and glutes can help to relieve the tension on the lower back muscles. I hope this helps to answer the question. If you have any thoughts on this subject, please let me know below the comments.